Hello, my name is Liliana Ruiz, and today's topic would be caring for the pediatric psychiatric population. Today I will be discussing how I would assess and care for children and adolescents with psychiatric concerns, including the use of screening tools, evidence-based treatment strategies, and safe medication management. Pediatric mental health care requires a combination of clinical expertise, compassion, and attention to developmental needs. Now, assessment of children and adolescents. When assessing a child or adolescent, I would start by gathering information from multiple resources. This would include clinical interviews with both the patient and caregivers, behavioral observations, and input from teachers and other caregivers to understand functioning across settings. Myers ETAL 2021. I would also consider the child's developmental stage, their family dynamics, and comorbidities, such as the child having anxiety, learning disorders, or sleeping difficulties, because all of these can influence both the diagnosis and the treatment plan. A thorough assessment would help me create a treatment plan that is both individualized to the patient and practical for the child's daily life. As far as age-based screening tools, I would use a validated age-appropriate screening tool to support my assessment. For example, for ADHD in school-age children, the Vanderbilt ADHD Diagnostic Rating Scale is widely used. For broader mental health concerns, I would use the Pediatric Symptom Checklist, PSC 17, and the Screen for Child Anxiety-Related Disorders, or SCARE, Jones ETAL 2022. These tools would help identify areas of concern early, track symptom changes over time, and guide referrals when needed. I would use objective measures in addition to interviews and observations made. And I would also ensure accurate and comprehensive assessment. As far as medication management goes, a medication can be essential for managing pediatric psychiatric conditions. I would prioritize FDA-approved medications for children. For ADHD, stimulant use such as methylphenidate-based medications such as Ritalin and Concentra, and amphetamine-based such as Adderall and Vyvanse are first-line options. Cortez ETAL 2023. If a child cannot tolerate the stimulants or has contraindications when using, I would also consider non-stimulants such as atomoxetine, such as Strattera, or alpha-2 agonists such as Venlafaxine, extended release, and also known as Intuniab. For medications not formally approved for pediatric use, I would carefully weigh the risk versus benefit when prescribing it for the patient. I would also monitor closely for any side effects and obtain informed consent from caregivers. Importantly, I would always combine medication with behavioral intervention, skill building strategies, and school supports to provide comprehensive care. Cortez ETAL 2023. And in conclusion, caring for the pediatric psychiatric population requires a very thorough assessment, use of validating screening tools, safe and evidence-based medication management, and integration of behavioral strategies. As a psychiatric mental health nurse practitioner, I would aim to provide holistic care that supports both the child's mental health and their daily functioning. And then also, as I stated, by combining clinical expertise with empathy, collaboration with families and schools, and evidence-based interventions, I would help children achieve better mental health outcomes and improve daily functioning and their overall well-being. Thank you for watching.